Everyone knows that the doctor will always suggest that you get your yearly flu shot or that you get your children their immunizations on time. But most people don't know the pros and cons, the benefits, the risks, and the history of the vaccinations that they are either declining or agreeing to give their children or themselves. One of the biggest debates among new parents is whether to vaccinate their children or not. Some people feel that the benefits do not outweigh the risk, or that the vaccines are against their religious or vegan beliefs. Others feel that it is important to vaccinate your children, and that people who do not vaccinate their children are at risk for spreading diseases. While many of the diseases vaccinated against are not common in the U.S. currently, the reason for the decline is due to the vaccines, and stopping vaccines may cause these diseases to come back. The first vaccine was created in 1796 for smallpox. Edward Jenner observed that the milkmaids would not catch smallpox once they had cowpox. So he began an experiment with an 8-year-old boy. He used material from a cowpox sore in one of the dairy maids. After the boy did have cowpox and recovered, he repeated the experiment, but this time added a small amount of smallpox into the same child. He hoped that the procedure would immunize the child against a deadly smallpox infection, and he would not get it, which it did. His experiment began the immunization age. In 1800, Richard Dunning referred to this as a vaccine, and by 1881, Louis Pasteur proposed to honor Jenner and expand them to cover the new inoculations being introduced. Vaccines essentially teach your body how to defend itself when germs such as bacteria and viruses invade it. They expose you to a small amount of the virus or bacteria that have been weakened or killed. Your immune system will then learn to recognize and attack this infection if you are exposed to it later on in life. Because of this, you will not become ill, or you will have a milder infection. There are 4 different types of vaccines available. There's the live virus vaccine, which uses weakened or attenuated form of the virus. Killed or inactivated vaccines, which are made from a protein or other small pieces taken from a virus or bacteria. There are toxoid vaccines, which contain a toxin or chemical made by the bacteria or virus. These will make you immune to the harmful effects of the infection instead of the infection itself. The last one is biosynthetic vaccines. These contain man-made substances that are very similar to pieces of the virus or bacteria. Vaccines help protect against many diseases that used to be much more common. Many of these infections can cause serious or life-threatening illnesses and lead to lifelong health problems. Because of vaccines, many of these illnesses are now rare. For a few weeks after birth, babies have some protection from germs that cause diseases. This protection is passed from their mother through the placenta before birth. After a short period, this natural protection goes away. At about 2 months, children typically begin to receive vaccines. Some people worry that the vaccines are not safe and may be harmful for their child. They may choose to wait or even decline the vaccines. But the American Academy of Pediatrics, the Centers for Disease Control and Prevention, and the Institute of Medicine all conclude that the benefits of vaccines outweigh their risks. The only time that a person should not receive a vaccine is if their immune system is weakened, or if they are pregnant and the immunization they are trying to receive is a weakened virus. These live vaccines can be dangerous to the fetus of the pregnant woman or to the person with the weakened immune system. Although thimerosal is no longer used in children's shots, except for some flu shots, parents have been concerned about the ingredient in the past being linked to autism. Even though there have been several research studies that show no evidence of any link between the two. Thimerosal has mercury in it, but it is not the same type of mercury that is found in some fish that stays in the human body and causes illness. Thimerosal is different. It does not stay in the body and is unlikely to make anyone sick. It is an additive to certain vaccines that can prevent bacteria and fungi from growing. There are also allergic reactions that some people may have. They are rare, and they're usually to a certain component of the vaccine, not the vaccine itself. There are many benefits to vaccines. They can save lives. They have kept children healthy for more than 50 years. Most childhood vaccines are 90 to 99% effective in preventing disease. If a child does get the disease, the symptoms are usually less serious than in a child who has not been vaccinated. The ingredients in vaccines are safe in the amounts used. In order for them to be licensed in the U.S., the Food and Drug Administration reviews all aspects of the development, including how and where the vaccine was made, and all studies that have been conducted in people who received the vaccine. If the vaccine does not meet the standards for effectiveness and safety, the FDA will not license a vaccine. The results of these studies will then get reviewed again by the Center for Disease Control, the American Academy of Pediatrics, and the American Academy of Family Physicians before a licensed vaccine is officially recommended to be given to children. Vaccines are necessary. In the U.S., vaccines have protected children and continue to protect children from many diseases. However, in many parts of the world, many vaccine-preventable diseases are still common. Since some of these diseases still occur in the U.S. and others may be brought in by Americans who travel abroad or from people visiting areas with the current disease outbreaks, it's important that all children are vaccinated. They study vaccines to monitor for safety after licensure. The FDA and CDC created the Vaccine Adverse Event Reporting Systems. This is so if anybody has any adverse effect from any vaccine, the doctors must report these side effects. Parents can also file reports with them. Now, the majority of your immunizations are done as a child, but there are also booster shots that are just as important as the initial vaccine. These are designed to continue your immunity. When less than 90% of children are immunized in a particular community, the pockets of low immunization create an environment where infectious disease can take hold and spread. Only a small percentage of children in the U.S. are completely unvaccinated, which is about 3%. However, most of them tend to be in certain geographic regions. The clustering of unvaccinated individuals in certain areas diminishes the benefits of herd immunity. Herd immunity is the benefit that everyone receives from a vaccinated population. When enough people are vaccinated, everyone, including those unable to get immunized because of being too young or too sick, are protected from the spread of diseases. Vaccines are also cost effective because it is always cheaper to prevent a disease than to later on have to treat it. The risks of natural infections outweigh the risks of immunizations for every recommended vaccine. There are also cons to vaccines. They can cause serious and sometimes fatal side effects, but typically only mild side effects such as swelling where shot was given, and they do not last long. Vaccines do contain some harmful ingredients. Thimerosal was one. Aluminum is also used in some vaccines, and excess aluminum in the human body can cause neurological harm. Formaldehyde, which is also found in some vaccines, is a carcinogen. Exposure to this can cause side effects such as cardiac impairment, central nervous system depression, coma, convulsions, or death. Many people also feel that the government should not be able to choose what their medical choices should be or religious medical choices. Several religions oppose mandatory vaccines. Some people feel that vaccines contain ingredients that are immoral. Some, such as the chickenpox vaccines, are cultivated in cells from two fetuses aborted in the 1960s. Some vaccines are made from using animal products, which would conflict with vegetarian and vegan lifestyle. Vaccines are unnatural, and natural immunity is more effective than a vaccination. The pharmaceutical companies, FDA and CDC, they feel should not be trusted to make and regulate safe vaccines. Pharmaceutical companies' main goal is to sell drugs and make a profit. They don't feel that these should be the people that are regulating the safety of vaccines. Diseases that many of the current vaccines are for have essentially disappeared, and the diseases are relatively harmless in many cases, meaning that the vaccines are unnecessary. Those were some of the arguments that people that are against vaccinations argue. Some of the side effects of vaccinations, the typical ones that more people will commonly have, are injection site reactions such as pain, swelling, and redness, a mild fever, shivering, fatigue, headache, muscle and joint pain. A far less common but serious reaction is an anaphylactic reaction or an allergic reaction. This occurs in less than 1 in a million cases. My daughter just received her first round of shots, and I found myself arguing with her father about the benefits outweighing the effects of the vaccinations, because it did make her a little crankier, and she did have a slight fever, and she seemed a little sore in the spots that the injections were given. So I found myself explaining to him the benefits of her having them, and tried to persuade him to be okay with her getting her next round of shots, which is at 4 months. Typically, kids get the hepatitis B at birth, 2 months and 6 months, the rotavirus at 2, 4, and 6 months, the DTaP at 2, 4, and 6 months, the HIV at 2, 4, and 6 months, the PCV13, which covers 13 types, at 2, 4, and 6 months, the polio vaccine at 2, 4, and 6 months, the measles, mumps, and rubella at 12 months, the chickenpox at 12 months, and the hepatitis at 12 months, and of course, your yearly flu shot. If you have any other questions, feel free to ask. Thank you for watching.